Hello, I am Dr. B.V. Rao of Usha Clinic and founder of the websites fewmedicaldoubts.blogspot.in and Dr. Raghava medicaldoubts.in. Today I am going to discuss about the esophagus and deformities of the esophagus. Esophagus is a muscular tube from the pharynx to the upper end of the stomach in the chest. It is closely related to the aorta, left main bronchus and the left atrium. It has two sphincters, one at the junction with pharynx and the lower at the junction with the stomach. The musculature of the upper part is striated and at the lower part is smooth. It is lined with the squamous epithelium and glandular elements may be at the lower end or as islets at irregular points along its entire length. Now we will discuss about dysphagia. Dysphagia is the difficulty in swallowing. Most diseases of esophagus and its adjacent structures can cause dysphagia. The causes may be painful disease of the mouth and pharynx. Painful diseases like stomatitis, tonsillitis, quinsy, tuberculosis, laryngitis, retropharyngeal abscess can cause dysphagia. And the cause also is readily apparent. Neurological disturbances of deglutition. These are due to bulbar and pseudobulbar paralysis, diphtheritic neuritis or myasthenia gravis, or disorders of esophageal motility, as in achalasia and esophageal spasm, are very common. The extrinsic compression of the esophagus. The pressure from the outside of esophagus like goiter, aortic aneurysm, cardiac enlargement, pericardial effusion, enlarged mediastinal lymph nodes secondary to lymphoma or carcinoma of the breast or bronchus. It is a presenting symptom and the underlying cause is apparent. Intrinsic diseases of the esophagus. These are of different types. Congenital abnormalities, atresia. The upper esophagus ending blindly at about the level of tracheal bifurcation occurs occasionally, requiring urgent surgery in the newborn. A short esophagus with hernia and stricture can occur as congenital abnormalities, though most examples are probably due to acquired disease. The other is ulceration. The ulceration of the esophagus is due to reflux of gastric contents through a sphincter made incompetent by hiatus hernia. There is acid pepsin digestion of esophageal mucosa immediately above the hernia, with ulceration, spasm, and stricture formation. Esophagitis and stricture are occasionally caused by corrosives like acid, bleach, or caustic soda. Tumor. The carcinoma of esophagus or cardia of stomach is the usual cause of dysphagia in elderly patients with no history of indigestion or heartburn. Other causes of dysphagia. These include sideropenic dysphagia, in anemia due to deficiency of iron, a combination of symptoms as dysphagia, glossitis and anemia is known as Plummer-Vinson syndrome or sideropenic dysphagia. Other symptoms are diminished gastric secretion and koilonychia and splenic enlargement. There is a degeneration of tongue, pharynx, esophagus and stomach. The dysphagia is for solids than to liquids. Dysphagia is due to spasm in the beginning of the esophagus. Diagnosis. It is by post-cricoid web demonstrated in radiograph and endoscope. Treatment. The dilatation associated with diagnostic endoscopy is sufficient to relieve spasm. Iron therapy is given. Advised periodic review to prevent post-cricoid carcinoma and scleroderma. Here the collagen fibers of the dermis become swollen, dense and sclerotic, causing contracture and deformities of joints of alimentary tract, lungs, etc. It also occurs due to psychological stress and cause globus hystericus. Patient may complain of a lump in the pharynx and a difficulty in swallowing. It acutely occurs between males, common in nervous people, occasionally sideropenia. Dysphagia may lead to such conditions. Diagnosis. To exclude the malignancy is essential in diagnosis. Barium swallow and esophagoscopy are required to exclude any structural anomalies. Manometry and cine radiography can give valuable information about diagnosis. The demonstration of disordered esophageal motility by manometry is of diagnostic significance in such conditions as achalasia, scleroderma, etc. That is all about the upper esophageal problems. We will discuss about the lower esophageal problems like hiatus hernia in the next video. Thank you.